Welcome back to Childbirth Education here at HighPoint Health. My name is Amanda Parker and you are watching part 3. We are going to discuss cesarean sections and postpartum care. The definition of a cesarean section is the use of surgery to deliver babies. 25 to 30% of births will be done in this manner. We would do a C-section if a vaginal delivery would put the mother, baby, or both at risk. Here are the reasons for a C-section, as you can see listed here. The first example is breech presentation, and this is when the baby is trying to present bottom first or feet first instead of head down. The next example is fetal distress. Sometimes this occurs before labor, sometimes during, and sometimes not until the end, but this is why we use a fetal monitor to check on your baby. Placental problems would also be another reason for a C-section. Sometimes these are known during pregnancy. For example, if the placenta is covering part of the cervix, a vaginal delivery can't occur. Sometimes placental issues don't happen until labor and delivery, and this would be evidenced by fetal distress. Another example of a reason for a C-section would be failure to progress. Failure to dilate means that your body has just stopped opening up in preparation for delivery. Despite strong contractions and despite doing interventions to help us get stronger contractions, sometimes your body just doesn't want to dilate. Another example of this is failure to descend. And this is when the baby just doesn't want to come down into the pelvis despite strong contractions and despite good pushing effort. Lastly, pregnancy-related issues such as severe uncontrolled preeclampsia, uncontrolled gestational diabetes may be reasons for cesarean sections. So we understand that a C-section may not be planned, and it can seem very scary and daunting. So that's why I'm going to break down the procedure right here. First, we'll make sure that you have adequate anesthesia, and by this, we don't want you to feel pain from your bra strap line down. You'll still be able to feel pressure and pushing and tugging, but you should not feel pain, and this will be tested before any incision is made. A catheter is placed in your bladder, and your abdomen is prepared and draped. Your labor support person is brought in to sit with you by your head. A crossways incision near your pubic hair line is performed by the surgeon, and a similar incision is done on the uterus. At that time, the surgeon can reach into the uterus and guide the baby's head through the opening while an assistant is pressing on the abdomen from above. This helps facilitate delivery. At that point, the baby is brought out and shown to you and then taken to the warmer to be evaluated by the nurses. We believe in skin-to-skin contact even in the operating room, so the baby will be brought over and placed against your chest while the physician is finishing the surgery. At that point, you're taken to your recovery room, which is just your labor room that you were admitted to. I want to talk more about anesthesia for C-sections. Sometimes, if you've had an epidural, we can give a different medication through that epidural to maintain good C-section coverage. In cases of planned C-sections or non-emergent cases where an epidural isn't already in place, we may use a spinal, which is very similar to an epidural. It's done in the same position and it feels the same. However, instead of a catheter being placed in the back, all of the medication is given all at once and nothing remains. Sometimes, if we can't get good coverage with the epidural or the spinal, we may need to use general anesthetic, and this is the process of going to sleep. So as I said, after your C-section, you'll be taken back to your recovery room. Sometimes a long-acting pain medicine is given through your epidural and your spinal to help with that first day post-op pain. Some physicians use an on-cue pain pump, which is pictured here. This pain pump is connected to a catheter that has multiple holes on it. The catheter is placed underneath the incision during the surgical procedure. This allows a small amount of numbing medication to be delivered directly to the incision while you are in the hospital with us. This can help with some of that stinging incisional type pain. In addition, we'll use ice packs to help reduce swelling and discomfort. You'll also have pumps on your legs that help with your circulation and prevent blood clots. Now, the key for a good surgical recovery is to get up and moving as quickly as you can. So the nurses will get you up in 10 to 12 hours and at least seated in a chair. Your urinary catheter will remain in place until you're able to move around and get up to the bathroom on your own. So let's switch gears and talk about postpartum care. The postpartum period is full of ups and downs. It's full of changes, some of them great and some not so fun. But I'm going to talk about all of those right now. The biggest change in the postpartum period occurs to your uterus. The uterus starts out about the size of a pear, and during pregnancy it is 11 times that weight. Immediately after delivery, it goes down to about the size of a grapefruit and can be felt right near your belly button. The process of involution, which is basically means that the uterus is shrinking down to that pre-pregnancy size, is accomplished by contractions. Now, these won't feel anything like your labor contractions. Most describe them as heavy menstrual type cramping, but they occur immediately after delivery and well into that first week. Now, we want the uterus to be tight and really firm, so they'll be checking on that periodically during your recovery period. It decreases about 1 centimeter a day until it's back to its pre-pregnancy size in about 6 weeks. You will be given pain medication after your delivery. One of the most important is either Motrin or ibuprofen. This really helps with that cramping pain, helps to reduce some swelling as well. If that's not cutting it, you can also use Norco after vaginal deliveries or Percocet after C-sections. You'll also be given stool softeners, and that's because digestion changes so much in the postpartum period, and also pain medications can cause constipation. We'll be giving you your prenatal vitamin, which is so important in the postpartum period, especially if you're breastfeeding. If you had some extra bleeding or you came in with low iron, we may start you on an iron supplement in the postpartum days. So lots of changes that occur in the postpartum period. The first is bleeding. You're going to be bleeding pretty heavily, especially those first couple of days. It will be very bright red and very heavy. After that, it changes to more like a heavy type period on days 2 through 4, depending. It's always increased first thing in the morning. So if you've been laying down and then you go to get up, you may notice a gush, and that's very normal. It also increases after nursing. Nursing releases a hormone called oxytocin. This is similar to the Pitocin that I talked about in part 2, but this causes uterine contractions. With uterine contractions comes a little bit of extra bleeding. So don't be surprised if you notice an increase in bleeding during and after nursing sessions. You'll also have an increase in cramping at that same time. Especially in that first week, your bleeding may increase with activity. So if you're home and you notice that your bleeding has picked up, it may be a sign that you're doing too much and you need to scale back your activity. You really want to use that first week just to take care of yourself and your baby. After going home, if you're soaking through a pad with clots in an hour, you'll want to let your provider know. During labor and delivery, there are lacerations that can occur to the vaginal tissues. This is just tearing. Another thing that can happen is something called an episiotomy, and this is more rare, but this is an actual purposeful cut made in the vaginal tissues that can occur with a vaginal delivery. These areas will be really sore for the first couple of weeks. Ice will help during the first couple of days, so we'll be rotating ice packs to keep you comfortable. When you get up to go to the bathroom for the first time, the nurses will give you a peri bottle. This is a squirt bottle you can fill with warm water to help ease the discomfort while you're urinating and also help keep the area clean. You'll be given witch hazel pads. These are circular discs that can be placed against the area that provide a soothing, cooling effect. In addition, we'll provide you with Dermaplast, which is a numbing spray you can use on the area. You'll always want to remember to pat the area dry and never use a wiping motion until you know the area is healed well. This will be checked at your 6-week postpartum visit, and I want to mention how important that visit is. We want to make sure that everything is back to normal, including your uterine shape and size and your episiotomy or laceration. Everything should be back to pre-pregnancy size and shape. It's important to know here that you do not want to have sexual intercourse until you see your provider at 6 weeks postpartum. This is so the laceration can be confirmed as healed, so you don't have any problems that first time. It's also important to know here that vaginal dryness can occur, and you can also get pregnant even if you are not back to your periods. You can still ovulate, so you want to make sure that you talk to your provider about birth control at that 6-week postpartum visit. Vaginal dryness is mentioned here as well, and I want to encourage lubricants, especially those first couple of times back to intercourse after delivery, especially if you're breastfeeding, because breastfeeding changes in the hormones can cause some of that extra vaginal dryness. Your digestion changes, as I mentioned before. Constipation is very common, so stay up on those stool softeners if you need to, and drink plenty of water, especially if you're nursing. In addition, your body may have hemorrhoids because of the pressure from the baby and the pressure from pushing. And we can take care of those in the hospital with creams or foams. We can also send you home with a prescription for one of those things. The day after delivery, it'll feel like you ran a marathon, so your muscle aches and pains will be there. Use heating pads on low and take your ibuprofen to help ease that discomfort. Something that no one told me was about hair loss. Hair loss, even in that first year postpartum, is very normal. It will grow back, but at first it can be very scary. In addition, during your labor and delivery process, you probably received IV fluids, especially if you had an epidural or you had a cesarean section. All of that fluid has to go somewhere, and so you may notice a lot of swelling. Just like in pregnancy, you want to make sure to keep your feet elevated and drink plenty of water. Generally, the swelling goes down in about a week. Another big change is to your breasts. Your breasts are made up of these items here. You have the milk producing cells, and that's what makes the milk and empties it into the milk ducts. You have your nipple in the middle, with the areola is that brown or pink tissue surrounding the nipple. You also have fat tissue where your breast is as well. After delivery, when your milk comes in, those milk producing cells really engorge with milk, and the ducts also engorge. At that time, if you are not breastfeeding, it'll be important to use those sports bras to help keep pressure on the breasts. This can help relieve some of the discomfort from engorgement, because this will occur regardless of if you are breastfeeding or bottle feeding. Something I want to talk about is the baby blues. These are very common in the days and weeks postpartum. You can have episodes of crying, you can feel more irritable and angry, you can have more fatigue than what's normal for a new mom. You may have lots of anxiety, especially about how you're caring for your baby. You may have a restless feeling where it's really hard to get your thoughts to settle. All of these changes are very common and normal as your hormones change during postpartum period. You want to make sure to keep track of these signs and symptoms and make sure that they're not affecting how you're caring for yourself or your baby. Because just like baby blues, there's something called postpartum depression. And this is both similar and different from baby blues. Similar in the sense that it occurs in the postpartum period and it has many of the same similar symptoms, but it's different in that it can be much more severe. You have feelings of hopelessness. You have a loss of joy even when doing things that used to bring you joy. Even when looking at your baby, you can feel a loss of joy. That anxiety that you felt for the baby blues turns into a more fear. You may also notice panic attacks. This may cause you to isolate yourself and for you not to take care of yourself or your baby like you should. It's important for you to reach out to your provider, your labor support person, your friends, your family, just so that you can talk about these changes. Also talk to one of us because we are more than happy to help you get through this period of time. Postpartum depression is very treatable, so don't hesitate to reach out. Now, thoughts of harming yourself or your baby are considered emergent. You would need to seek emergency care for that. They will not take away your baby. They want you safe and healthy, so don't hesitate to reach out, especially if it gets to that point. So, on a final note, all of the changes during postpartum can be very scary and daunting, and a lot of joy is there too. Don't hesitate to call a provider to talk about any of these changes, or if you have any questions, definitely reach out. So this concludes part 3. We're definitely going to discuss part 4. In that section, we're going to go over newborn care and breastfeeding. So stay tuned for that and come on back. Thank you.